Hi, today we're going to cover our Chapter 2 ICD-10 guidelines for neoplasms. So we'll get started on that. And I'm also going to show you guys a couple new tools that are uploaded onto the Coding Spot. So let's get started, and let me go ahead and open up our guidelines. Okay. And I'll share my screen. Okay, so today we're going to start with our Chapter 2 neoplasms, and we're going to go through and cover the examples that are in our book as well. So remember, this is directly from our ICD-10 book. These are our chapter-specific guidelines. They are in that one place in front of your guidelines. Here, let me just open this up. So these are your guidelines in PDF format for ICD-10. And the guidelines that we're covering are those exact same guidelines, but with examples. And these are located in the front of each chapter. So if you remember that. Now, if you are following along in your book, you would just go to Chapter 2, Neoplasms, and this would be the beginning of that chapter. So let's get started. The Chapter 2 contains the codes for most benign and all of our malignant neoplasms. So if you are familiar with those two terms, then you know that benign is non-cancerous and malignant is cancerous. So that's the simple definition of those two terms. Certain benign neoplasms, such as prostatic adenomas, those are found in the specific body system chapter. So a little bit different. Hang on, let me just see if I can change this view. I thought I could, okay. Anyway, sorry about that. So let's see. The first example that we have here are, we're going to start discussing how to properly code a neoplasm. And it's necessary when we're coding the neoplasm, we have to determine whether in the medical record it states that the neoplasm is benign, in situ, malignant, or of uncertain histologic behavior. So if it's malignant, we also look for any secondary, which are metastatic sites. So metastatic sites, what that means is the cancer started somewhere and it spread somewhere else. And those metastatic sites, those would be where the cancer spread to. And so you always, when you see a malignant neoplasm, you just want to make sure when you're reading through the medical record that you're also looking for any secondary involvement. Primary malignant neoplasms overlapping site boundaries. So this will be our first example here, if you can see right here. A primary malignant neoplasm that overlaps two or more continuous next to each other sites should be classified to the subcategory code 0.8, overlapping lesion, unless the combination is specifically indexed. For multiple neoplasms of the same site that are not contiguous, such as tumors in different quadrants of the same breast, codes for each of those should be assigned. So in our example here, we have a 73-year-old white female with a large, rapidly growing malignant tumor in her left breast. It's extending from the upper outer quadrant into the axillary tail. So it's giving us the location. As we can see, we would code C50.812, malignant neoplasm of overlapping sites of the left female breast. And our rationale behind that is because this is a single large tumor that overlaps two different sites, a single code for overlapping sites is assigned. And in our second example, we have a 52-year-old white female with two distinct lesions of the right breast. One is 0.5 centimeters in the upper outer quadrant, and the second 1.5 centimeters in the lower outer quadrant. Path reports indicates that both lesions are malignant. So that means that both of those lesions are cancerous. The patient has two distinct malignant lesions of the right breast in adjacent quadrants. Because the lesions are not contiguous, two codes are reported. So because they don't overlap each other, we would code the two separate areas that the malignant neoplasm is at, which would be our upper outer quadrant of the breast and our lower outer quadrant of the breast. So moving on to malignant neoplasm of ectopic tissue. So a malignant neoplasm of ectopic tissue are to be coded to the site of origin mentioned. So ectopic pancreatic malignant neoplasms involving the stomach are coded to the pancreas, and that code is C25.9. In the neoplasm table in the alphabetic index, that should be referenced first. However, in the histological term is documented, that term should be referenced first, rather than going immediately to the neoplasm table in order to determine which column in the neoplasm table is appropriate. For example, if the documentation indicates adenoma, refer to the term in the alphabetic index to review the entries under this term and the instructional note to see also of neoplasm in this site. It's important to select the proper column in the table that corresponds with the type of neoplasm. The tabular list should then be referenced to verify that the correct code has been selected from the table and that a more specific site code does not exist. Okay, so what does that mean? Well, if we are going to look up adenoma, why don't we go ahead and do that? So we go to our neoplasm table in our index, right? So remember that our index, neoplasm table, and we'd look up adenoma. So ADE. Okay. And if we don't find it there, then we're going to go ahead and look just at our term in our index, spelling it out. And there it is. So even though it wasn't on the neoplasm table, it's in our index under adenoma. And it tells us to also see also neoplasm benign by site. So we could go to the site given to us, and then from there we would go to benign neoplasm. Moving on, treatment directed at the malignancy. So if the treatment is directed at the malignancy, designate the malignancy as the principal diagnosis. The only exception to this guideline is if the patient admission encounter is solely for the administration of chemotherapy, immunotherapy, or radiation therapy. Then we'd assign the appropriate Z51 code as the first listed or principal diagnosis, and the diagnosis or problem for which the service is being performed is a secondary diagnosis. So I would definitely highlight this and study this little section right here. It's really just telling us that if the patient's admission is solely for the administration of chemo or whatever immunotherapy they're getting for malignancy, then we would assign Z51, and that's for encounter for chemotherapy. We would assign that code first. And then the diagnosis or problem for that, so whatever our malignancy is right after that. And this is the only exception for this rule. So if the treatment is directed towards the malignancy, then you would designate the malignancy as the principal diagnosis, unless the encounter is solely for the administration of chemotherapy or immunotherapy. And in that case, you would code that first, which is a Z51 code, followed by the malignancy next. Treatment of a secondary site. So when a patient is admitted because of primary neoplasm and it's metastasized and the treatment is directed towards the secondary site only, the secondary neoplasm is designated as the principal diagnosis, even though the primary malignancy is still present. So a patient with primary prostate cancer and metastasis to the lungs is admitted for a wedge resection mass of the right lung. So just going back to what we just learned, our first code would be C78.01, which is our secondary malignant neoplasm of the right lung. And our next code, our secondary diagnosis, would be C61, malignant neoplasm of the prostate. And our rationale, which we just covered, was since the admission for the treatment of the lung metastasis, the secondary lung metastasis is sequenced before the primary prostate cancer. So these examples really just illustrate what we just learned. Coding and sequencing of complications. So coding and sequencing of complications associated with malignancies and with the therapy thereof are subject to the following guidelines. So we have an anemia associated with malignancy. When an admission encounter is for the management of anemia secondary to malignancy and the treatment is only for that anemia, the appropriate code for the malignancy is sequenced as the principal or first listed diagnosis, followed by the appropriate code for anemia. So here in our example, we see a patient is admitted for treatment of anemia due to advanced colon cancer. Our colon cancer code, our neoplasm code, is coded first, C18.9. And our anemia and neoplastic disease is coded second. So even though the admission was solely for the treatment of anemia, this guideline indicates that the malignancy is sequenced first. So you can see that's different than our treatment, our administration of chemotherapy guideline that we covered. So what happens if we have anemia associated with chemotherapy, immunotherapy, and radiation therapy? Well, when we have an admission encounter for management of an anemia, which is associated with that adverse effect of administration for chemo, radiation, or immunotherapy, which is a common side effect of that, the anemia code is sequenced first, followed by the appropriate code for the neoplasm and the adverse effect. So that T45 is our adverse effect of drugs codes. And so it's just giving us an example of that. So see how, depending on why the patient is admitted or why the patient is having an encounter at all, really determines how we sequence the codes and what the codes are. So a 56-year-old Hispanic male with a grade 2 follicular lymphoma involving multiple lymph node sites referred for blood transfusion to treat anemia due to chemotherapy. In this example, our anemia due to anti-neoplastic chemotherapy is coded first, followed by our lymphoma, and then our adverse effect code. So if you look at these three codes, and then if you want to go and actually look these codes up, you'll see them, and you can, in fact, I should recommend that you guys look these codes up just so you can see how they're looking in the book. So just go to these codes after the meeting and look at how the notes below them, see where they are, and definitely highlight these three areas. Okay, so when the admission encounter is for management of anemia associated with an adverse effect of therapy, the anemia code should be sequenced first, followed by the appropriate neoplasm code and code Y84.2, radiological procedure and radiotherapy as the cause of abnormal reaction of the patient or of later complication, without mention or misadventure at the time of procedure. So in this example, we have a 55-year-old male with a large malignant rectal tumor. They have been receiving external radiation therapy to shrink the tumor prior to planned surgery. He's admitted today for a blood transfusion to treat anemia related to radiation therapy. So we have D64.89, other specified anemia, C20, malignant neoplasm of rectum, Y84.2, radiological procedure and radiotherapy as the cause of abnormal reaction of the patient or of a later complication without mention of misadventure at the time of the procedure. And the explanation is the code for the anemia is sequenced first, followed by the code for the malignancy, and lastly, the code for the abnormal reaction due to radiotherapy. We have management of dehydration due to malignancy. So when the admission encounter is for management of dehydration due to the malignancy and the dehydration is being treated, either IV rehydration, the dehydration is sequenced first, followed by the code for the malignancy. And it's just really important to, if you can't memorize these guidelines, which it's hard to memorize all of these guidelines and it gets confusing, make sure you know exactly where they are in your book so you can reference them when a question like this comes up on the exam, because it will. Treatment of a complication resulting from a surgical procedure. So when the admission or encounter is for treatment of a complication resulting from a surgical procedure, designate the complication as the principal or first listed diagnosis if the treatment is directed at resolving the complication. Moving on, we have our next section, which is for primary malignancy previously excised. When a primary malignancy has been previously excised or eradicated from the site, and there is no further treatment directed to that site, there is no evidence of any existing primary malignancy, a code from category Z85, personal history of malignant neoplasm, should be used to indicate the former site of the malignancy. Any mention of the extension, invasion, or metastasis to another site is coded as secondary malignant neoplasm to that site. So the secondary code may be the principal or first listed with the Z85 as a secondary code. So they give us an example here, and I'm glad because all this mumbo jumbo gets pretty confusing. History of breast cancer, left radical mastectomy 18 months ago with no current treatment. Bronchoscopy with lung biopsy shows metastatic disease in the right lung. So they had breast cancer. It's now a history code. The patient had a mastectomy, had both of the breasts removed, right? That cancer is no longer present, but they had a bronchoscopy and a lung biopsy, and that resulted in metastatic disease in the right lung. So even though their breast cancer is a personal history of now, they had it and it's no longer current cancer, we still need to capture that information. And you can see why capturing that information might be important, right? Well, first, we have a secondary metastasis. So we have the C78.01, secondary malignant neoplasm of the right lung. And our personal history of breast cancer code is telling us, okay, first we had breast cancer. We don't have it anymore. It's a personal history of it. But now we have a secondary metastasis into the lung. So it's really important that we code both of those. And our rationale given is the patient has undergone a diagnostic procedure that revealed metastatic breast cancer in the right lung. The code for the secondary metastatic site is sequenced first, followed by a personal history code to identify the former site of the primary malignancy. So that's a lot to retain. That's why I say it's really important that you just know where these things are in your book so that you can cover them and reference them while you're taking the exam. So a tab, even, if you've tabbed your chapters in your ICD-10 book, then you can just tab, neoplasm guidelines right there. And then you can make little notes in your book that direct you to the important sections, or sections like what do you sequence first if the encounter's for anemia due to cancer, right, or malignancy. Okay, so we're going to take a little break now, and we'll restart in just a minute.